Good morning and welcome to another edition of KSM TV's How-To Series, and today we are here talking about how to find a good chiropractor. And we're fortunate enough that we have Dr. Jonas Eyford with us this morning. And Dr. Eyford, I really appreciate you being here with us and taking the time to talk to our audience and explain to them what they should look for when searching for a good chiropractor. So we appreciate you being here.
David, and I appreciate being here.
Yeah, great. I've had personal experience with a chiropractor, and I am a proponent of chiropractic because I know the issues that I had and how much it helped me. And I had neck surgery, and I had issues with mobility, being able to turn my head, and I basically went against my surgeon's orders, and I had a chiropractor help me, and he restored nearly full range of motion to my neck, which the surgeon told me that I would never have. So I am a big proponent of chiropractic care. So if someone were watching this program and they were looking to find a good chiropractor in their area, how would they really go about it? Because for me, it took me a while to find the right one that was the right fit. I didn't really know what I should be looking for, what criteria. So maybe you could help somebody else not struggle the way I did to try to find a good chiropractor the first time.
I'd be happy to shed some light on that. It's not uncommon to hear success stories that often people are surprised almost, but it does require finding the right fit. Like any professional relationship, you need to find somebody who's well suited to treat your specific condition and somebody you mesh well with. So what I always recommend is first and foremost, you need to go to someone with a good reputation. That's somebody who is either a friend recommends you to, somebody you trust, or somebody who has a well-established practice that's quite popular. That typically lends to the individual's credibility. The other things I'd recommend looking into when you do come across a name or a professional is their specialty, what they tend to focus on. Oftentimes, you will see a lot of generic or just family practices, and that's not a bad thing. However, if you are suffering from a particular condition, you have a certain issue, it's nice to be able to find somebody who specializes in that. And there are many different specialties. So, for instance, there can be chiropractors who specialize in pregnancy and infants, and there can be ones that specialize in chronic pain, in sports and athletics and athletic injuries. So, depending on what your specific issue is, I'd recommend looking into finding somebody who addresses those specific concerns first. Then comes the trickier part. A lot of people get confused here, which is assessing or making a judgment of the chiropractor's credentials. So, like many medical credentials, we don't really know oftentimes what we're looking at. You see Dr. So-and-so, FC9B6, that man symbol, and it seems like gibberish, but it's important to do just a little bit of research into what this person's credentials mean, because sometimes credentials can be, a weekend seminar somebody took here, and that could be great, but may not be relevant to you. And in other cases, an individual could be, having took a 4-year residency program, post-graduation residency program, and specializes and is in a very reputable technique or therapy that would benefit you. So I always recommend looking into what those funny letters mean behind someone's name. Aside from that, I think chiropractic, like many other professions, has a diverse array of techniques. So there are a great variety, and I won't go off and list them, but I think if you are aware of a specific technique that you want, that you've heard of, that you know is good or reputable, then I'd recommend looking for someone who provides a specific technique. And I won't go off listing the specifics, but that's something to look into as well. And the last thing is shop around. I think this is something I do myself when I'm in the market for any type of practitioner. Is you have to meet the person. You have to make sure that you can have good rapport with your practitioner, that you get along with them, that they empathize, that they listen well, that they give you the time. A lot of people walk that fine line between being busy and being too busy. And so finding somebody that gives you an amount of time that you're comfortable with, and just makes you feel heard, because you have to feel like you're being treated to actually respond to the care. If you feel like you're getting the respect and being listened to in the way that you want, you're more likely to respond well to the treatment.
Well, that's incredibly helpful information, and some of the things that you pointed out there are things that if I would have known this when I was searching, would have saved me a lot of time and trouble, because the first chiropractor that I went to helped me to a point, but just he was I guess he just really wasn't the right fit, as you explained in there, and I went to someone else, and again, they weren't really the right fit, and they helped me a little bit. But when I finally did find, on my third try, I was amazed at the results that I got and how quickly I got those results. So the advice that you gave is just for someone who's watching this, I think is going to be a real time saver for them, and also going to enable them to get the proper care, and whether it's pain relief or comfort or whatever. My particular issue was range of motion and some pain issues, which were completely resolved by chiropractic care. So, and I also find it very fascinating that you mentioned something else, and I had heard this once before, but I never realized that babies can actually be have chiropractic care. And would you want to just maybe explain a little bit about that? Because you mentioned it. I know people will be watching this and saying, babies? What does that mean? So maybe you could talk a little bit about that.
Certainly. I think within the last decade or so, there's been a significant amount of research that's shown that colic is very effectively treated by chiropractors. Treating infants is actually it's quite popular now because it's very safe. It's very not soft, but I guess it's a conservative therapy. It's not very invasive in any way, and like I said, it's been shown to be very effective in treating colic, which is something that has a profound impact on both the infant, obviously, but the parents as well. So that's one specific area where chiropractic has become popular in children and infants, and there's various other benefits too. There's been some studies recently on the correlation between chiropractic treatments and attention deficit and asthma. The positive correlations are a little more blurry in the research there than they are with colic in particular, but there have been all sorts of benefits like that to clearing out the child's nervous system and making sure that any effects, musculoskeletal effects that they might have had, any traumas they might have had during the process of childbirth, are addressed. Because these are things that are often overlooked in a hospital, during a birth and after a birth. These are things that might be too subtle to be picked up and addressed by the medical staff at the time.
That's fascinating, and one of the things that I see with chiropractic is that going to a medical doctor, they're most of the time they're very quick to write you a prescription and give you some pills and send you on your way. And a lot of these drugs, if you watch any television at all, how often do you see an attorney's ad come up for a lawsuit, a class action suit against a drug company, for a drug that has had major side effects. And I think that with chiropractic care, it's you're not dealing with that kind of a thing. You're looking at it from an entirely different angle, and you're helping so many people. So I would advise anyone. I'm a testimony to chiropractic care working. So I would advise anybody to look into it if you've not found any relief, other ways. So, Dr. Eyford, if someone were watching this and they were in the Greater Toronto area, which is the area that you are in, and they were interested in coming to you for chiropractic care, what kind of experience would they expect to get from you?
A good one. Typically, my priority at first is to make somebody feel welcome and comfortable, because I find that unless somebody is comfortable, I'm not able to establish the relationship that will give me enough information to be able to really have a profound impact on their life. And that's what I'm set out to do. So whether it's from a series of adjustments or using certain therapies or modalities or whatever the case is, I find that my first effort is always to build a relationship. So I like to spend some time chatting and figuring out what the real whole picture of your issue is, not just your knee or your low back. It's your whole issue, your lifestyle, your habits, the activities you partake in, the type of work you do. Everyone suffers from different types of strains on their body. I like to identify the cause of those strains and then work with that individual to not only relieve your symptoms with my hands, but also work with you to create a sustainable plan to keep you out of pain and enhance your health in various ways. So a typical visit begins with a good history and physical exam, and then I use whatever modality or therapy is most appropriate. And we typically have a course of treatment that may last for days to weeks to who knows how long, depending. And I tend to work closely with other practitioners that you might see. So whether it's your family doctor, a specialist of some sort, a naturopath, a massage therapist, a physiotherapist, I like to make sure that I'm in close communication with everyone that's treating you so that everyone's on the same page and that my treatments are well informed and what I do is known to the other people that see you. I feel that's an important part of creating sustainable health.
Yeah, great information. Well, folks, Dr. Eyford, I really appreciate you taking this time to be here and explaining all this, because I think you've saved a lot of people a lot of time in searching for a chiropractor, and also maybe convincing some people that chiropractic care is right for them. So if someone is in the Toronto area and you're looking to visit a chiropractor and you would like to stop into Dr. Eyford's office, you can reach him by calling 416-789-2449. Again, that's 416-789-2449. And Dr. Eyford, I really appreciate you being here, and thank you so much for taking your time out of your day here. I know you could be doing other things, but we really appreciate your time with this interview.
Thank you, David. I appreciate your time as well.
Well, folks, there's another edition of How To, and if you would like to visit Dr. Eyford, again, the number is on the screen. Please give him a call and set up an appointment, and we'll see you on the next episode.